let's talk about some questions because I know many of you all have some questions and I wrote a lot of them down. So we're going to talk through some of them. Let me take one more sip of tea. Questions. I'm a little nervous about these questions, y'all. So I'm going to do my best to answer them. All the while, I want to remind you, yes, I am a clinical psychologist. However, I am just speculating. We are having fun here. I am not formally or officially diagnosing anyone. I'm just giving my thoughts and my opinions and my insights based on the same series that you watched, okay? Okay, question number one. Why do you think Reesa fell for everything that happened in this relationship? Why do I think Reesa fell for all this, right? Because and I think this is a valid question because many of us or many of you, many people that were watching this were thinking, girl, I wouldn't have got past this and this and this because I would have done such and this and that, right? So why is it that she was so vulnerable to so much deception and betrayal? I honestly don't have, I feel like I don't have an answer. I think that that would require a lot more evaluation and assessment on my part. Like if I were her psychologist, um, if I, as her psychologist, was working with her and I wanted to get to the bottom, or like, let's say she came into therapy with me and she asked, why did I fall for all of this? That would be an intention that we would set to work through and process and reflect through a number of sessions. I imagine it would take me at least 5 to 10 sessions to really get to the bottom of this for her. That would actually be really dope if I could do that with her. But some things that I suspect, she many times kept saying how she just was hoping that it was finally her turn. And I want to go here with this question because I think this can illuminate a lot. Many times throughout this series, she just kept saying, I just wanted it to be my turn. I was just so hopeful that it was finally my turn. And what she meant by that was she wanted to be loved. She wanted to be desired. She wanted to be accepted. She wanted to feel cared for. She wanted those experiences of, you know, a partner doing the big things just for her, because he loved her. She wanted it to be her turn. She likely experienced feeling as if she's watching other people have this experience and she's also wanting it too, which is so fair and so valid because all of us, whether you are, regardless of your gender identity, we want to be loved. We want to be cared for, many of us in different ways, but this is something she wanted for her life. And I think that the thing that came up for me is that sometimes our desires can be so deep and we might be so fearful that we don't get to have them. It might impair our judgment in other circumstances, right? So it's possible, and I'm not saying this is definitively it, but it's possible that for Reesa, because her desire for partnership was so great, because her desire to be loved and cared for and to feel all those feelings and to finally be chosen or to have it be her turn, that desire was so deep and so great for her. It may have impaired her judgment when she felt like it was finally on its way. It's possible that because there was some pain or some grief around that desire, that it just impaired her judgment a bit about how careful she needed to be, or how intentional she needed to be, or how conscientious she needed to be about this circumstance because her desire was so great for it. So I think that's all I want to say to that because I don't want to go into speculating anything about like her attachments or her trauma history because again, if I were her psychologist, I would want to uncover more about her early childhood experiences. I would probably ask her about what those were like, what her early relationships were like, because sometimes when we find ourselves in situations like this, maybe early on we didn't have the best experiences with regard to attachment to our primary caregivers, or maybe there were some traumatic situations that interfered with bonding and attachment. So many things could have happened, but I don't know if that happened to Reesa. So I want to leave that question right there. I think that's the best response for that one. Okay. Number 2, do you think it was wrong or right for her to share so much personal information about Legion and other people? That's a fair question too. Do you think it was right or wrong for her to share so much personal information about Legion and others? I'll be honest, y'all, I'm neutral on this. I'm neutral because I feel like lately, as I have aged, and honestly, even in my therapy practice too, as a psychologist, I often take a stance of neutrality, non judgment. And so a lot of times when I'm, working as a psychologist, I'm often in a place where like there is no right or wrong. There may not be any right or wrong decisions. There's no right or wrong judgment. There is no right or wrong thing. Rather, there are options, there are alternatives, there are circumstances, there are choices and decisions you can make. And we just have to be very aware of the consequences that may follow. That's the stance I take on it. Like, I don't know if it was right or wrong for her to share so much information, but I think that she has to be ready and prepared for whatever outcomes or consequences that come. And so a lot of times when I'm working with my clients in therapy, I'm also talking with them about, is this right for you to do? Is this wrong for you to do? I don't know. But let's work through the pros and cons of the situations or the decisions. Let's work through the potential consequences of each one so you can decide which one aligns better with what I want for my life, or which decision or choice or situation aligns better with the goals I have for myself. I think that's a better way to approach things, because sometimes things are not right or wrong. Things are not just black and white. There's gray. It could be somewhere in the middle. And for Reesa, she just needed to be ready to accept whatever consequences came. And if she could be at peace with that, then hey, it's all good. So I think that's how I want to answer that too. I don't know if it was right or wrong, but I think at the end of the day, Reesa had to be ready to accept any outcome or consequence that comes with telling her story so publicly. And I think she was. I think she handled it all very gracefully, and she continues to do so. Okay, number 3. This one, y'all. Um, this is a highly anticipated question. Because I got this question several times. What mental health diagnoses may have caused Legion to act the ways that he did? Again, I am not formally diagnosing nobody. I can't do it online, okay? I can't do it by watching a story and then boom, diagnosis. But I'm speculating here. We're just going to have fun with this. So in the series, so I'm going to actually talk through 5 different diagnoses that potentially people might be thinking about, or that might come to mind when they think of this story. So in the story, I think in the later parts, like part 47, 48, something like that, Reesa learned from Legion's brother that Legion had been diagnosed with 2 different mental health disorders. And according to the brother, Legion was diagnosed with these disorders as a child. So I already, red flags go off for me, but let's talk about it first and I'll explain to you why. So first, it said bipolar disorder. So let me just read a little description really quickly and to describe bipolar disorder for anyone who is unfamiliar. Bipolar disorder is typically characterized by periods of depression and then abnormally elevated moods. So we might see periods of low mood, which might be characteristic of depression, but then we also see these very elevated moods. We often call those manic episodes or hypomanic episodes. Those are the episodes that are a little less severe. But typically, bipolar disorder is a fluctuation in these moods. No, it's not like, oh, today she was this, tomorrow she was this. It's not that simple, you all. And that's why it's so important to talk to a licensed mental health professional about these things. But in general, my very quick explanation is it's a cycling between very low moods and then also very elevated moods, or periods of very elevated mood that can be very dysfunctional for your life. Is it possible that Legion could have had bipolar disorder? quite possible, because sometimes what can happen is if someone is experiencing a manic episode, it can absolutely interfere with their decision making, their judgment. There's a lot more risk taking behaviors, and there's also a lot of grandiose thinking when a manic episode can be occurring. But something that makes me suspicious about this diagnosis for him is that it seems like these behaviors were pretty long standing and continue to occur for long periods of time. And typically with a manic episode, these episodes may last a few days to maybe a week at the most. And so if it were truly bipolar disorder for Legion, I think we would have seen a cycling for him, where we would have seen him engaging in these really odd, bizarre behaviors, the thinking, all of the like pretending and all of that, highly possible during a manic episode. But I think we would have seen him cycle a little bit more, where he came back down and seemed more clear, more aware, right? Like we didn't really see that in the story. So I'm also suspicious because I don't believe that we can adequately diagnose bipolar disorder in children. That's not fair. And unfortunately, that happens to Black children, especially Black boys, far more than it needs to. I have seen so many Black boys receive diagnoses of bipolar disorder when they're teenagers. And a lot of times what it actually is anxiety or post-traumatic stress disorder. And so I actually am questioning the diagnosis for him that he received as a child for bipolar disorder and thinking it probably was not correct. Schizophrenia is another one that's coming to mind for a lot of people. Did he have schizophrenia? And so I think, quick description for schizophrenia, characterized by recurring episodes of psychosis that often are correlated with a general misperception of reality. So perception of reality is just off. It is not on the same basis as other people. Commonly includes hallucinations, which is hearing things or seeing things, experiencing things that are not based in reality, but then also delusions, a lot of paranoia, a lot of disorganized thinking, social withdrawal, and flat affect. So what I will say about, could Legion possibly have had schizophrenia? Maybe, I don't know, because I have not met him. I have not evaluated him, but I'm a little skeptical about the schizophrenia diagnosis because per her story, he was a lot more functional than I would believe someone with schizophrenia to be, right? Yes, he told a lot of lies. Yes, he was doing a lot of things that did not really actually happen and were not actually happening. But typically someone who does have schizophrenia, they are not always as able to be so highly functioning as it seems like Legion was capable of being, right? It does seem like for a while he did have a job. It does seem like he was able to keep a schedule going with his day to day. It does seem like for the most part he was able to care for himself when he had access to resources, right? He was able to hold a functioning conversation with people, right? So I'm skeptical. I actually don't know if that was a true diagnosis or is an accurate reflection of him. But again, maybe, I don't know. I also, again, super skeptical because typically we don't see schizophrenia develop until young adulthood. So maybe between 18 and 20 years old or 25 years old. It sounds like he received a diagnosis of schizophrenia as a teenager, and super, super skeptical about that. All right, let's talk about a third potential mental health diagnosis for Legion, dissociative identity disorder. This one may not be as familiar. It used to be referred to as multiple personality disorder. This is a condition that is extremely rare, but let me read a little bit of a snippet. It says, dissociative identity disorder is characterized by the presence of at least two distinct and relatively enduring personality states. It can be accompanied by memory gaps that are severe and can't be explained by ordinary forgetfulness. The personality states alternatively show in the person's behavior and in their presentation, their thoughts, their mindset, all of that. So with this one, I actually haven't heard anyone online mention this as a possible diagnosis for Legion, but I just wanted to throw it in just because I felt like it could be something that someone might bring up. But what I will say actually against this one is that with this story that Reesa told about Legion, for the most part, he was one person. Yes, there were a lot of bizarre circumstances and a lot of pretending, a lot of deception, but I don't think per her story we can say that it was reflective of someone who was experiencing multiple personality states, enduring states, right? Like we didn't really get that with him. So actually for this one, I don't think that this is something that he would or potentially be diagnosed with to make this story make sense. All right, I want to talk about two more disorders, but what I will say is that these other two are personality disorders, which are a little bit more severe. When it comes to clinical diagnosis, and again, personality disorders are extremely rare. But I think sometimes in culture, in our society, we talk about personality disorders as if they are very common. And that's why, again, it is so important to talk about these things with a licensed mental health professional so that we actually have context for what we're talking about and we really understand what we're talking about. And again, today, the purposes of this is fun. I will continue to repeat that. We are having fun here. But I think it's important to talk about these two because I know that someone online is probably trying to diagnose Legion with one of these two. Let's talk about narcissistic personality disorder. I know that this is a very common one that people like to talk about online, and they often just will refer to it as like a narcissist, like, oh, he's a narcissist, or they have narcissism, right? And so what I will say is that like culturally the term narcissist or culturally the term narcissism is not the same thing as a clinical diagnosis of narcissistic personality disorder. Okay. So with narcissism or someone being a narcissist, when we talk about that, like culturally online, it could be reflective of someone who maybe tells a lot of lies, maybe someone who needs an excessive amount of admiration or a lot of feelings of self-importance, right? So much so that they completely dismiss other people and they elevate themselves often. There are a lot of people who do that in our society, but that doesn't necessarily rise to the level of a narcissistic personality disorder. Okay. So when we talk about a narcissistic personality disorder, when we talk about personality disorders, period, they are always characteristic of long standing patterns, chronic patterns that impair the functioning of someone, right? They are associated with significant functional impairment, particularly in relationships or within someone's ability to care for themselves or to function at work, right? Long-standing patterns, not just, oh, when I was in relationship with this, he did it. Far more, far more. Long-standing, enduring patterns of dysfunction. Okay, so narcissistic personality disorder specifically, long patterns of exaggerated feelings of self-importance, an excessive need for admiration, diminished ability to empathize with other people, might be characteristic of a lot of, let's see, I'm trying to read my notes here to see which one is most important to say or to mention. Intense and pervasive feelings of shame, worthlessness, low self-compassion, and a lot of self-loathing. So the funny thing about narcissistic personality disorder is those things I just said that shame, worthlessness, low self-compassion, and self-loathing. That's really what's happening on the inside for these people. But on the outside, there's this perception or this portrayal of something completely opposite. But it's like, I have to present this way because deep down inside, I feel so terrible about myself. I feel so low. I feel so bad, right? So these people will go all out at all lengths to do the things that help give them some self-worth and some meaning through admiration. They are also hypersensitive to criticism and possess intense need for admiration. We said this already. Motivated to achieve their goal, status, improvement, and perfection, and ignore relationships or situations due to fear of incompetence, failure, worthlessness, inferiority, shame, humiliation, or losing control. Could this diagnosis potentially explain Legion? Yes. Yes. And I was so hesitant to say that. But the thing I think that fits here, and again, cannot clinically diagnose him until I meet him and have an opportunity to diagnose him, to do a diagnostic examination, psychological evaluation. And even with personality disorders, it's really hard to diagnose that in just one session. I would need multiple sessions with him. And I will also need accounts from people around him to fill in the gaps. But either way, could this explain it? Yeah, you all. And I think the thing for me is the long standing pattern, these long enduring patterns, right? Per his family's stories and per the history, per both of his ex-wives' accounts, it sounds like these are cycles and patterns that he have been exhibiting for a very long time, according to his family, since he was a child. And they have not let up. They have very much impact his ability to function in relationships and at work. And this other part where he went all out to great lengths to be perceived as competent, successful, important, went at great lengths to receive admiration. He made up stories. He talked on the phone by himself for 30 minutes. He lied about so many things because he wanted to appear one way when really deep down inside he felt another way. He wanted to appear successful, important. He wanted to be admired. And he did whatever he needed to do to get Reesa to feel this way about him. He went at all lengths, deception, betrayal, all of it, to get what he needed. And that's why when she said in one of her final parts, she was like, I realize now Legion never loved me. He never loved me. He didn't even like me. Facts. Because really, the whole experience with Reesa was about making himself feel good. It made himself feel good when he saw how excited she would get about the cars, how excited she would get about looking at the houses, how excited she got about the potential London trip. All of that made him feel good. It made him look good to say he was the VP of a department or his work phone, his work car, right? Showing off how much money he's got in the banks, in the offshore accounts. All of that made him look good. It made him feel good. It made him admired by this woman when deep down inside, he probably feels so worthless, so much shame, so much self-loathing, so much just low. So he had to do whatever he needed to do to feel much better. And that could potentially be narcissistic personality disorder. Again, I want to say this one more time, and other psychologists online say this constantly to you all. Narcissistic personality disorder is not something that all of your exes have. It's just not, okay? Many of your exes probably have a lot of maladaptive coping skills and not great attachments. However, that is not the same thing as a narcissistic personality disorder. But what Reesa experienced, could definitely rise to the level of this man might have had a narcissistic personality disorder. Ooh, child. All right, last one we're going to talk about before I get up out of here. This other one I wanted to throw in potentially just in case, and it is antisocial personality disorder. Let's see, did I pull up a tab for this one? I did. Antisocial personality disorder. Again, remember, it's a personality disorder, so it's a long-standing, enduring patterns that you might see in this person that significantly impair their functioning. And with personality disorders, we're often seeing that impairment be in their relationships, in their ability to show up in the world, right? So for antisocial personality disorder, sometimes this is called being a sociopath, a mental health condition in which a person consistently shows no regard for right or wrong and ignores the rights and the feelings of other people. These people tend to purposely make others angry or upset, manipulate or treat others harshly or cruelly or indifferent. They lack remorse and do not regret their behaviors. People with antisocial personality disorder often violate laws, become criminals. They may lie, they may become violent, impulsive. They may have substance use issues. So with this one, the key here with antisocial personality disorder is always that lack of remorse and that lack of empathy. When we as people lack remorse and lack empathy, it can make for a very dangerous person, right? And again, this is not your ex who didn't care that he hurt your feelings. This is not your ex who didn't care how you felt after the breakup. This is not even your ex who didn't really consider you when he cheated on you. This is not the same. Rather, when I think of antisocial personality disorder, I think of Jeffrey Dahmer. I think of any other serial killer that you may know about in our society. I think of serial rapists, individuals like that who are able to commit very violent acts and not be bothered, right? So for this one, I'm a little hesitant or questioning whether he might meet criteria for anti-personality disorder. And I think it's because for me, when Reesa was telling the story, I didn't get the sense that his actions and behaviors really reflected a lack of remorse, but more so was better reflective of some of the things we saw with narcissistic personality disorder, where this intense need to present well versus the lack of remorse or empathy, right? When I think of antisocial personality disorder, at the core, I think of a lack of empathy that is driving the disorder. But when I think of narcissistic personality disorder, I think of an immense need to cover up shame and self-loathing as what's driving the personality disorder. And when I think of Legion and how she talked about him, for me, it feels like at the core, it was him needing to present well, to be admired, to appear successful, that was driving a lot of his decisions and the moves he was making. Ooh, that was interesting, right? It was fascinating. Okay, two more and then I have to go. This other question, what are your thoughts on Reese's pregnancy loss and any perinatal mental health challenges she may have experienced? So what I will say is that in general, this part was heartbreaking, but also so relieving. And we hate to say that, but I think everyone who watched the series can relate to that. Like, could you imagine if she had his child? Could you imagine? Like, someone else also asked me another question, so I'll couple it with this, is what would have been the outcome if she did have his baby? The outcome would have been that she would have continued to have to go through this experience with Legion because she would be permanently tied to him, right? And then, granted, on the other hand, she could make a decision if she were to have his child to completely cut ties. But then there's always going to be that guilt in that the what ifs about how does this decision impact my child, right? Having to make the decision to cut off a child from their parent because of the parent's reckless life or bad decisions or because they can't get it together. Sometimes you do have to do that, but then you're also left with that guilt and the negative feelings that are associated with having to make that decision. But I think for me, I would have been so worried for her and the child if she would have had Legion's child. So I think a lot of us, again, very hard to admit this, but we kind of breathed a sigh of relief because we just couldn't imagine a baby being brought into this. I couldn't imagine. But with her having experienced a pregnancy loss, I was very concerned for her because she was already going through such a traumatic situation with regard to this relationship. So it really didn't feel like there was any room at all to cope with the loss she's experienced. And even in the story, it was kind of glossed over, and probably because it had to be, because her mindset, her focus was completely preoccupied and filled with all of the betrayal and the deception and the lies and trying to piece together all of the clues for what and who she married, right? So I imagine that now in her trauma recovery process, she's probably also trying to deal with the grief and the loss she's experiencing regarding that pregnancy loss. Like, I just don't even think there was a possibility for space to be made for that for her when everything was going on. So I hate that for her, and I hope that she is getting the treatment that she needs. Okay, last question. How important is it for women to fact check when they're dating men? Okay. I sat with this question for a while because my gut reaction is if you feel like you have to be fact checking when you're dating someone, that's not the one you're supposed to be dating. It's just not, because just even the idea of fact checking when you're dating, whether they're a man or a woman or regardless of their gender identity, if you feel like you have to fact check details or information someone is giving you, that tells me that there is something being compromised when it comes to trust and vulnerability. And if you can't feel trust or safety or a level of vulnerability in relationships that you're in, that's not a solid relationship. That's not a healthy or a positive relationship. I don't think that women should be feeling like they have to fact check everything that someone tells them. That's not okay. So then I guess the other part of it is like, well, what do you do? How do you know? How do you know? This leads me to this conversation of red flags and intuition. And I think this is the perfect thing to end this episode on today, because I know this episode has gone a little bit longer, but it was worth it. In Reesa's story, she constantly said, I ignored the red flags. I saw it, but I didn't do anything about it. I didn't realize this was a red flag. And I think online, on the internet, there's a lot of conversation and also a lot of resources about what are potential red flags when you are engaging in a romantic relationship with someone. I think it's important for us to just be aware of that and to know what those red flags are, right? So if you don't feel safe, if you don't feel like you can trust this person, if you don't feel like you're being cared for, if you don't feel like you're being respected, these are also not the same as we disagree. This is not the same as there is conflict, right? It's very much different. And so we have to be aware of what should I reasonably expect from someone when I am in a relationship with them, and be aware of those red flags. But then more importantly, right? So for instance, I'm thinking, well, what if somebody just truly doesn't know the red flags? Or sometimes we don't know if people are telling us the truth. Like, sometimes people do lie, and it does seem like it makes sense. That's when intuition is so important. And even for Reesa, she constantly said, I had this gut feeling that something was off. I had this gut feeling that something wasn't right and I ignored it. I truly believe that women, particularly, have a very deep connection to their intuition. I think many of us make our best decisions when we are connected to ourselves intuitively, when we can feel our feelings and are instinctually connected to that inner self that's trying to give you information. But sometimes we're disconnected. Sometimes we can't hear our inner selves. Sometimes we can't hear our intuition. Sometimes we have experienced so much trauma, we also don't trust our intuition. But I encourage you to do some work, whether it is in therapy, whether it is your own self reflection or journaling, or just through the process of caring for yourself and loving yourself more. I want you to become reacquainted with your intuition, that internal self that is constantly trying to give you information about any situation that you're in. When we are connected to our intuition and our gut feelings, it will always tell you when some shit's going down. But the issue is that sometimes we get so disconnected from it, we cannot hear it. We cannot even recognize it when it's trying to talk to us, and we don't trust it. So I want to end on that note today. I really want us to really be thinking about intuition. Is our intuition trying to tell us something? I know many of you have had experiences where you're in a situation and there's something in you that's like, this isn't right, or something's not okay. That's your intuition talking, and then it's telling you, no, it's not okay. This is not for you. This person is not for you. This situation is not for you. We have to really start listening to that, even if it means we might be disappointed, right? Like for Reesa, she kept saying, I want it so badly for it to be my turn. So that means that listening to her intuition would have meant it's not her turn. And that's painful and that's hard. And so we also have to commit to listening to our intuition, even if we know that the outcome of listening is going to be painful. Even if it means that listening to our intuition means that it's going to be a consequence that we don't like, or we're going to lose something or someone. We have to be okay with listening, because our intuition never steers us wrong. Our intuition wants the best for us. It's kind of like your inner child that just wants to look out for you and protect you, or a dear ancestor that's watching over you, trying to guide you. Think about your intuition in that way and really just start to listen and to embrace with it.